the next year now in February, I go to Dubai with my wife to watch John Legend jazz. And we go there and then I'm called. I'm told, the board really would like to talk to you and they're here tomorrow. I'm like, no, I'm in Dubai.
Yes.
So I say no.
I can't come.
I can't come. And I even write an email and say, all the
I'm
best.
not even around.
I'm not around. All the best, you'll find the best candidate. And health also gives you the ability to learn. That's why we say, healthy children learn, healthy adults earn. So learning and earning are both linked.
They exist,
to health
coexist.
because of health. So you have to be healthy. If you're not healthy, you can't earn.
Yes.
And you're not healthy, you can't learn. Okay?
Yes. I will now switch gears to your current role.
Yes.
At Amref.
Yeah.
You are the CEO of Amref. Tell us how that came to being after being in Smartrain for how long were you in Smartrain? After Nation?
I was in Smartrain until 2015.
2015.
Yes.
Okay.
Until 2015.
So you joined Amref in 2015. What was the motivation to switch from Smartrain to Amref?
So this is what happened again. So I am doing my Smartrain work and I'm enjoying it thoroughly. I'm traveling to Ethiopia.
And it's impactful.
Congo. Impactful. You're just saying, there's nothing as impactful as you find a child who was hidden in the house by the family, never goes to school because of this cleft lip.
Yes.
You repair, they go to school.
And they're able to smile like other kids.
In 45 minutes.
Wow.
Because the operation
used to take 45 minutes.
45 minutes. It's very simple.
Wow.
We once operated on a woman in Ethiopia, and she came out and she cried. She said, I wish you did this to me before, because I would have gotten married.
Because she's now more advanced in
She's more advanced. She was like 50-something.
Yes.
So life-changing. And all you needed was the photo before, the photo after, and you paid the doctors and the hospital. So it was just building, and we had done so many of them. So, and Amref was actually one of the partner organizations we're working with.
Supporting this project.
Supporting this program.
Yes.
So we would actually fund them to train the doctors, to ensure we reach more, to get people to look out for the kids using community health workers and all that. So one day, a headhunter calls me. I'm driving up on Valley Road and he says, Githinji, can you talk? I say, I'm driving, let me stop. I stop. We talk, he says, there's this role, Amref, you know Amref? I'm like, yeah, I know Amref. I know them, they're flying doctors, I all these
I've
things.
worked with them here.
They have been my partners. And interestingly, when I was in medical school in 4th year, there used to be a section that we used to call an elective term. And you could actually get a job. So Amref had given me a job in Kisumu to go do some questionnaire filling for sexually transmitted diseases.
Okay.
I was there as an intern. So now they're like, okay. I say, so what do they want? They say they're looking for their CEO, the group CEO, Director General. I say, no, I'm not interested.
I'm happy where I am.
I'm happy where I am. He says, are you sure? I say, yeah. Because this is the job I'm doing. I'm actually running Muruna.
Yes.
And I'm also running around, I'm doing this job. And this job allows me the freedom and we are making impact. He says, I say no. Then he calls me later, like 2 days later, says, why don't you come, we have coffee. So I go to Westlands, we sit.
Let's talk, yeah.
We talk. He's got Zia Manji. So we talk. He says, why don't you leave me with your CV? I say, no, I'm not interested. No, just give me your CV. There could be something else.
Yeah.
So I send him my CV.
Yes.
Next thing I know, I'm being called to go for an interview by Amref. So I was going to Tanzania to do Smartrain work. The board of Amref was in Tanzania. And I go, before I go, they say, the board canceled the interviews. I'm like, okay, good riddance. I'm actually doing my work.
It's even good for you.
It's even good
You're
for
not
me.
interested.
So later, the next year now in February, I go to Dubai with my wife to watch John Legend jazz. And we go there and then I'm called. I'm told, the board really would like to talk to you. And they're here tomorrow. I'm like, no, I'm in Dubai.
Yes.
So I say no.
I can't come.
I can't come. And I even write an email and say, all the best.
I'm not even around.
I'm not around. All the best, you'll find the best candidate. They persisted. The end result is that I end up changing my flight because now they have insisted so much. And that's how I got the job.
Really want to go. Wow.
Yes. So that's how I got the job.
Yes.
And I joined June 2015.
Yeah.
Now, at that point, I was a reluctant joiner, but it has been my most impactful job in my career.
Wow.
Yes.
I have seen you say somewhere that health is the biggest cause of poverty.
Yes.
Can you tell us what you mean by that in the context of, because I know you are also an ardent and you're very passionate about universal health coverage.
Yes.
So just explain to the viewers and those watching us, first of all, what universal health coverage means and why it is important, especially for us in our context in Africa. And of course, it's a global thing, but it's probably more required here in our circumstances. So maybe just explain for those who don't know what it means.
All right.
And why it is important.
So there's something that we talked about in one of the episodes about human capital.
Yes.
That human capital is your ability to exercise and realize your full potential when you now reach working age. That's what human capital is.
Yes.
You reach working age at 18 or so.
Yes.
Therefore, how much you build in yourself, health and education, so that when you're 18 you can now harvest or realize your potential. Is that human capital. Therefore, if you do not realize good health, you'll never be able to realize your human capital.
Objectives.
Okay. So health gives you the ability to realize your human potential, be socially and economically and politically active. And health also gives you the ability to learn. That's why we say healthy children learn, healthy adults earn. So learning and earning are both linked.
They exist,
to health
coexist.
because of health. So you have to be healthy. If you're not healthy, you can't earn.
Yes.
And you're not healthy, you can't learn.
Learn.
Okay?
Yes.
So the relationship between health and poverty is linked by this circle.
That ability to learn and then to earn.
Absolutely. That's the most simple, without going to a very complicated thing.
Yes.
But remember that at the same time, other than health being a contributor, positive contributor to your learning and earning, it can also be a negative contributor to your wealth. Because if you're unhealthy, then you spend your wealth to be healthy. So other than this foundational value, if you are not healthy, you can use your money to become poor. Now, that's the entry point to universal health coverage.
Okay.
That when across the world, we say that health is a human right. And health being a human right, I like to say is the most foundational human right, because you can have the right to vote, but if you're not healthy,
you can't
and
even
you're in
vote.
ICU, you can't vote.
You can't even vote.
You have the right to go to education. If you're not healthy, you can't go. So it's the most foundational human right.
It disables you.
It disables you. Now, what happens is then the question is, if there's a human right, who should provide the right to you? And it is very clear, health is on government. Not necessarily paying for it, but organizing it and making sure it's available to everybody, whether they can afford or not. Okay?
Yes.
And doesn't mean that if you can afford, the government pays for you, no. But it must be organized in such a way that even those who can't afford are provided for within a structure for them to
have access.
Afford. So that you never have to think, do I have money to go? I have a headache. Do I have money to seek care? You must never have to think that. You must seek care because there is a process that is pooled your resources to ensure you get that health
when it's required.
That is universal health coverage.
Oh, wow.
So universal health coverage is not insurance, it's not this and that. It is the ability to provide the health services, not only health care, not only hospital, the health services, including family planning, including nutrition, including vaccination, the health services and individual needs when they need it without financial difficulty. That's UHC. That's universal health coverage. Now, how you provide and how you make sure there's no financial difficulty. You can use insurance, you can pay directly. Those are now
a combination of many.
Each country will use its own approach.
Yes.
But as long as everybody in a country can access the services they need when they need them without financial difficulty, that's universal health coverage.
That's very important.
Yes.
because we are also having cases of now people saying, oh, I mean, I had assets. I had to sell an asset, you know, to either it's my relative or myself to be able to access and to afford.
Absolutely.
You know, to pay
because the government
the
did not
bills.
provide the universal health coverage.
Yeah.
And therefore, when you need the services,
you
actually have to look for money. And if you don't have it, you sell your land.
Yes.
You sell your livestock. In actual fact, more than 1 million people fall into poverty every year in Kenya
because of
health bills.
Lack of
in Kenya
that
alone.
Health. Yeah.
Yes.
Wow. In Kenya.
1 million.
Wow.
Yes.
Wow.
1 million every year. More than it's about 1.5.
So, as a follow-up to that, what can you, as an operator in that space, recommend? What needs to be done? What is it that people can do about it? To make it more accessible, more affordable.
I think there are elements of it that are happening, there are elements of it that have been happening, but I think the bottom line is that it's a very complex issue. The government must identify the poor and provide a mechanism for them to afford care. Whether it is through paying premiums for them, whether it's providing care that is free, that they can actually go and access. When I know there's nothing free, it's actually tax funded.
Yes.
You must identify the poor and focus on them.
And somehow deliver a solution for them.
You must focus on the poor. I think the challenge I find with governments, in my experience now across Africa and elsewhere, is that when you talk about universal health coverage, the word universal means 100%. But you focus on 100% being everybody in the country, including Githinji and Mary.
Yes.
But what about saying, my universal is the poor?
Yes.
And therefore, first and focus on anyone who can afford. And that when I have achieved 100% of those, that's my universal coverage.
Yeah.
Because
especially those without a pay slip.
Yes.
At the end, it doesn't matter the size of the pay slip.
Exactly.
Yeah.
So if you can actually redefine universal, so that is more practical. You're saying anyone who cannot afford, and of course you have measures for affordability. First, we'll make sure those
are covered. They are covered
from prevention, diagnosis, treatment, admission. Then now, once you've covered that,
we think about
asking, how do we organize those who can afford so they also don't have to pay a lot?
And it's more efficient.
Pooling their money and maybe providing. And then the next thing is ensuring that you must put controls for price of medicines, for the amount of money that is charged for condition.
Are working.
Countries where universal health coverage works, other than America, because America is a messy situation. In Europe, there are controls.
Yes.
You can't have universal health coverage without particular controls and saying, if somebody has pneumonia, you should only give them the following drugs. And if this can't work, you give these. You can't just give whatever you want.
Anything.
Yes.
Wow.
So there has to be controls led by government, and that's why I say I believe in pro-poor universal health coverage. Meaning, start off with the poor, sort out those, then organize the rest.
Then you can organize everyone else.
Yes.
Tell us about COVID-19. Yes. We saw you. A lot of the people actually saw you the first time during COVID-19.
Yes.
Yeah, we continue with the conversation. This is the executive table. Continue watching.